Greetings everyone, this is Karen Ramos offering you a brief tutorial today on what makes your presentation visually appealing. As a part of your medical rotation experience, you've been asked to offer two different presentations, one to our physicians and one to the non-clinical staff. This is your opportunity to really stand out and show us what you have learned at the University of Cincinnati Medical Center. Chances are, you want to feel enthusiastic and confident about this idea. However, deep inside, you might be feeling that primal fight or flight urge to just jump on a plane and go anywhere else because you aren't certain yet what you're going to present or how you're going to present it. Don't worry, don't panic, just take a deep breath. With the right attitude and preparation, you can put together an excellent presentation after you get settled into the routine of your rotation experience. Have you ever heard of TED Talks? TED is considered to be one of the premier venues for some incredible public speakers. Keep in mind you are not expected to be a TED Talker, but listening to the best can help you hone in on your skills. In this module, we will cover ways to reduce anxiety and to get your message across to the audience through an effective presentation. This is your chance to set yourself apart from others. Remember, throughout your career as a physician, student, researcher, or scholar, you will be asked to give presentations on multiple occasions. So why not make it memorable and really make one that does not put people to sleep? Mastering the art of making a great presentation will benefit you personally and professionally. Creating a presentation will help you to develop confidence in yourself and shape your leadership potential. You have been selected to speak at the completion of your rotation experience for a reason. You are going to be observing some amazing physicians and see some really interesting patient case scenarios. With careful observation on your part, you'll be quite confident after spending 4 weeks here to share what you have learned with others. Keep documentation such as photos and notes on what you observe. This will prove to be the basis of your future presentation. When you aren't with patients, take a few photos of the clinic areas, other physicians, and trainees. How well you communicate your ideas will determine whether your presentation is memorable or forgettable, boring or interesting, and whether your audience will play on their phone or listen to you. There's a famous quote that says, "Talk isn't cheap." That could not be further from the truth. The truth is that talk can be very expensive, both literally and figuratively. When you attend a presentation, make a guess at the salary and cost of all the people in the room. Add to that the cost of preparing for the presentation and putting it together and using the equipment and space. That price tag can be quite high. Have you ever attended a presentation that's really long, boring, poorly delivered, and completely forgettable? Take a look at this picture. In this cartoon, the person standing on the stage isn't going to be killed by the guillotine, but rather by the bullets in PowerPoint. This is the type of situation you want to avoid. You don't have to use images of actual patients, because remember, HIPAA compliance is important, but you should consider using visual aids that deliver the message instead of words trying to deliver your message. The visual aids should rather support the message. Don't fill the slide with tons of text. People can read faster than you can speak, so if you're just going to read what's on the slide, your audience will just read ahead of you instead of listening to what you have to say. Your listeners will be attracted to your message if you are articulate, well-rehearsed, and you intentionally infuse effective visuals. Keep in mind that this is your chance to demonstrate what you know. So when you're preparing a visual presentation, whether it's on PowerPoint, Prezi, Powtoons, or some other visual platform, these should be used in moderation. You don't want to abuse or overuse visual aids to the point where they detract from what you have to say in person. Whenever possible, it's always better to use photos and graphs rather than words and numbers. Remember, keep it simple. Try dealing with just one main point per slide. Projecting a single powerful image will help to vary your presentation. In other words, eliminate as much clutter as possible. Your audience will grasp and remember a clear graphic presentation, but will quickly ignore and almost always forget something that appears to be complicated. Have you ever had a professor who speaks to the screen and not to the students? This is a great way to invite boredom. If you have to look at the screen, do so quickly, but then return to your audience to elaborate. Spend no more than 2 minutes speaking about a certain topic. If you must present something complex, give your audience a little bit of time to absorb that information before you start explaining. Finally, adding black slides to the program or to the presentation will bring attention to what you are saying. This will help to emphasize your message, and it gives pause to all of the other visuals in your presentation. Finally, by following these tips, you are on your way to creating a lasting presentation that your audience can understand and remember. Thank you for tuning in today.